Okay, from the 1099contractor.com, LOCUMCRNA.com. One of the biggest questions about going independent and going locums, or, as a CRNA, as a nurse, as somebody in the healthcare professions, going independent, a lot of people ask, how soon after school should I go and be independent? Honestly, most of the time you would be fine even if you went right out of school, but it's not the recommendation, because you're going to be in situations where you have to be able to take care of your patient in the best way possible, and there may or may not be somebody there with you. I've been doing it for 14 years, and even last night I was called in very late for part of the evening for a newborn, and not everything in our field is easy. Not everything in our field is always the best situation. And you need to be able to handle it, know what you're going into, and know how to keep yourself safe, as well as the patient and other staff that are around with you, and knowing their abilities and working with your own abilities. And so you really have to know your limits as a provider. If you need to ask for help or have somebody else go in, there are so many things that you need to be cautious of and cognizant of, and if you don't know your own practice right away, then I think you need a year or two of good experience before you're going out and trying to become a locum provider or a 1099 or independent. I think there's good reasons to have people around you. And as a new provider, if you did go the 1099 route right away, there are some larger institutions that will be fine with it, and you can get that experience. But you have to be careful as to what types of positions you're going to take right away, and making sure that you have the experience and knowledge base that you can start out the gate and have a good experience and have the best outcomes for you and your patients. So that's where I come from on the idea of going 1099 right away outside of school. And in nursing, I'd almost say it's harder to go and be a broad spectrum nurse or a float pool type nurse, going to multiple different wards or floors, ICUs, different types of care. So if you are going as a new nurse, make sure that you're getting that broad-based knowledge and then going into your ICUs and getting your full experience with that. It's going to help you so much more in the long run. And if you do go to anesthesia school, all that experience will definitely help you even years later in your practice. Even our newborn last night, we all worked as a great team and everything's going well, but it's definitely something that I want you to be aware of when you are going into your practice. I hope you had an amazing weekend, and today is an amazing day.